here's a couple pathways for life, of pathways of Ichi, or electricity. I said muscle tissue, when it's moved, stressed, stretched, tweaked, needled, it releases electricity, right? Well, is the heart a muscle? Every time the heart beats, it releases electricity. Where does it go? It goes to the highly conductive pericardial sac, and then into the pericardium channel, and then and feeds into all the other channels until it hits the kidney channel. Now, this flow is a little bit different than what we learned in TCM school. This comes from measurements from Dr. Tennant in Texas. When it hits the kidney channel, that flows into the Ren and the Du. It stays in the Ren and the Du until it exits on spinal nerves feeding organs. That's pathway number one. We got more pathways. Here, from beating heart into the fibrous blood vessels. Remember, that's one of the most electrically conducted tissues from that previous list. Another pathway from the beating heart into the fluids, which is highly conductive. And is the fluids unidirectional like the fascia? No, it goes wherever the heck it wants. The electricity travels wherever it wants in the blood, back and forth, wherever the deficiency is. And then the last is from the beating heart on these heart nerves into the spine, directly into the Ren and the Du channel. Now, what you're looking at here is a pH scale. I know, let me bring you back to biochemistry land for just a little bit. When you get a fancy pH device from Home Depot, there's a switch on there because you can measure, instead of pH, you can measure it in millivolt charge. So that 8 pH is equal to negative 59 millivolts. And we said that the nerves need to be negative 20 millivolts or greater to be healthy. So that's right where you're seeing this little red dot here, right around there. So to the left is less and less electrons. So although it shows a positive charge, that's just some fancy physicist's evil person making everything confusing. It's really that less and less millivolt charge, less and less negative charge, less and less benevolent chi. So that here is way more deficient than here, and even negative 10 is way deficient from negative 20. Does that make sense, y'all? Okay, so very clearly, when I say deficiency, I mean a deficiency of electricity. There is no excess in this system, because how can you have too much of a good thing? You can't. So that our machines are over here, because we said 1 volt is 1,000 millivolts, and our machines go up to 200 volts or higher. So that's a lot of potential for healing. The medicine is in the right types of electricity. This is why, you know, it's a good thing. A lot of practitioners are in electric medicine land, but they're not really refined to the way we're able to be precise. For example, you have chiropractors putting electricity on a patient. And if they're using microcurrent, it's helpful. Wherever they put the pads, the patient's going to get better directly. But they don't have the diagnostic skill or refinement to be able to know how it is, or diagnose why that patient's deficient in T9, and then see it through multiple treatments. They're just slamming electricity on there, which is a good thing, but they need to take my classes probably. Cancer. So we can use cancer as a diagnosis. If a patient has a history of cancer, we know that it became so deficient it got to a positive 30 charge or worse. Germ theory versus terrain theory. the main event, Louis Pasteur versus Antoine Béchamp. Well, you know what happened. Louis Pasteur was funded by Big Pharma, and on his deathbed said, because this is germ theory versus terrain theory, on his deathbed he said the germ is nothing, the terrain is everything. But the damage had already been done. But at least he cleared that off his chest before he died. So we are stuck in germ theory. I'm stuck in germ theory. It's taught to us by our parents, by schools, by them, by they, the nameless evil ones. And how do I know it's even ingrained in me? It's because when I walk to a restaurant and I'm walking up to the door and I think to myself, where can I touch on this door where there's no germs? But if you have cucumber seeds and you throw them on the floor, are they going to grow? No, because the terrain is more important than the germ. And germs aren't what they told us they are. What you're looking at here is a depiction of what Gaston Naissance saw under a live blood droplet. So you take a droplet of capillary blood, you look under the microscope, and this is what happens when the terrain of the blood is poor. What do I mean by poor? Anything not negative 20 millivolts or greater. And this here, the somatid, which is also called the protid, which is also called the microzyma, depending upon what part of the country or what part of the world you're from. These are the smallest form of life. Germ theory doesn't believe it. But you can look under a microscope for yourself and see these things. The somatid evolves in a poor environment into spores, into double spores, into bacteria. So streptococcus, strep throat, is a bacteria that was actually produced by a somatid that was in a bad environment. If the environment stays bad, the bacteria can keep getting and turning into larger and larger life forms. Bob Beck called it aliens in the blood, until it got past 16 and it turned into a cancer. But anywhere along here, when you correct the terrain of the blood by adding electricity, it stops forming larger and larger pathogens and starts regressing, turning back all the way back to the somatid. Once it's the somatid, if you keep the terrain good, and for blood, we're talking about 4 months, you got to keep the terrain good. Now the somatid can grow into, with the help of stem cells, into muscle tissue, bone tissue, hormones, healthy stuff. So that germ theory, they're saying, there it is, that streptococcus is the disease. And it requires a specific pharmaceutical that I'm going to charge you $1,000 a month for. But they're missing the point that that streptococcus was once a somatid, which is life, which is what we're born with. If you took a drop of your blood and you looked at it and you see the somatid and you could watch it for 12 hours, it's better than Netflix. You got somatids that are having romance, making babies, more somatids. And then you took that slide with the drop of blood and you put it in your closet for a year, and then after a year came back to check it. The somatid would still be alive, assuming the terrain's not horrible. If somebody's super severely diseased, that somatid's not going to be alive. But most of the time, it should still be alive for a healthy person. Now, what the heck's healthy? Well, Western medicine says 7.35 to 7.45 blood pH, which is related to millivolt charge, is healthy. But we know that negative 20 millivolts is 7.365. So anything below that, the disease has already started for us. Proof of concept. Here's radiological proof that electricity can change soft tissue and hard tissue. This is, your patient comes in and they say, I don't know if acupuncture can work because my doctor said I have bone-on-bone pain and the only thing that's going to work is a surgery. Well, you're looking at bone-on-bone pain here. This is osteoarthritis, hard, bony tissue that is irritating the local neural structures. 12 treatments later, when done correctly, like the way I'm teaching you this weekend, and this thing starts to go away. Of course it's going to go away because of that slide I just showed you. This pathogenic tissue, once you improve the terrain, is going to regress all the way back to the somatid, and then if you keep the terrain good, healthy cells can regenerate.